First, let's start with the American Rescue Plan. You did vote no. You cited a couple of things. First, the provision that the minimum wage was refused by the parliamentarian. Senate's going to pass that. It's going to come right back to the House for reconciliation anyway. But you basically said, and I'll let you get into this. It's too big. 1.9 trillion. You said there were about 500 billion. I think you said of really good spending, and beyond that, you said it was too big. So I'll let you elaborate.
Yeah, and so on the earlier point, I mean, we basically voted on a bill that we knew was going to come back to us anyways because it was already ruled, a portion of it, the $15 minimum wage, had already been ruled out of order by the Senate parliamentarian. So it was a bit of a not great use of time. But on the American Rescue Plan, right? So all the previous four COVID, relief and stimulus packages that we've had, overwhelmingly bipartisan, right? 80-90% of members of Congress, voting in support of these initiatives. The fact that Speaker Pelosi, President Biden, Leader Schumer, chose to use the budget reconciliation process, right? This is the same process by which Obamacare was passed in the second term of the Obama administration. It's the same, or sorry, first term. It's the same process by which the Tax Cut and Jobs Act was passed. I mean, this is usually what you reserve for things that you expect are going to be contentious, right? So despite President Biden's rhetoric around unity and pledging bipartisanship, this was essentially a way of achieving some policy wins in the first 100 days so that the Biden administration could kind of brag about them. I mean, that's why the $15 minimum wage was included. I haven't heard a compelling rationale for why that is directly related to reopening schools and getting us through the end of the pandemic. There were plenty of other components of it. There was some infrastructure spending. I'm not against infrastructure spending, but again, when you're bundling into what's supposed to be a COVID relief bill, it kind of beggars belief on what the rationality is.
I read up a little bit on that, and one of the reasons is from the New York Times, and they're talking specifically about the New Jersey Bridge to Canada and the San Francisco Transit Bill for BART. And it's
New York, upstate.
I'm sorry?
Upstate New York Bridge to Canada.
I said New Jersey. I didn't mean New Jersey. Yeah. Bill includes $30 billion to help public transit agencies, the bulk of which covers operational costs of transit systems across the nation. It's basically saying that it's a grant program that ensures already approved transit projects like the BART extension, as well as rail improvements in Republican-led states like Indiana and Arizona, remain solvent. Basically, they're saying is the pandemic has had a devastating effect on public transit systems across the country too, and they need relief as well. Do you deny that's not the case, that public transit systems need help because of the pandemic?
Oh, they've certainly been impacted by the pandemic. I think what I take issue with, and this has been repeated by some of the top members of the Biden administration, is that we must pass this right away, right? There is urgency. We can't reopen schools until we get this package out. So if we're triaging issues in terms of what is the greatest urgency, I was involved with a bipartisan effort 6 weeks ago to peel off the 160 billion as part of this package that went to vaccines, that went to testing, that went to PPE, saying, let's get that money out there. Now, granted, a lot of that money's already been appropriated. I think there's around $700 billion that was appropriated at the end of 2020 that still has yet to be spent. But if the issue around school reopenings, if the issue around how do we get money for vaccine distribution out as quickly as possible, if that's a timing issue, then why are we waiting weeks or months to put that out? Right? So I would much rather see us looking at these constituent parts independent of one another, rather than bundling it all together and saying we need to get this out now or else. Because that's what the budget reconciliation process has done. It's a take it or leave it proposition. It's not, let's debate what the numbers should be for state and local funding. I support some state and local funding as a component of this. In the plan that I laid out, it was calibrated based off of the income tax loss that the city of Grand Rapids had, and using that as a bit of a baseline to make sure that we're only covering valid, pandemic related losses, rather than allowing free reign for state and local governments to say, well, yeah, our pension plan had been insolvent for several years, but got especially bad during COVID, so we need you to help bail us out of that. Because if we get to the point where we're basically covering for fiscal mismanagement at the state level, and having the people the municipalities, the states that were managing their finances in a prudent way are going to be the ones who are paying for that. And that, to me, is putting us on a very dangerous path.
quick philosophical question. I don't want to ask you about the Dodge proposal from
I think
Senator
it's
Collins.
Doge. But,
Doge
yes.
sounds very French either way, no matter how you, but
Direct dollars over government excess. Yeah.
yes. President Biden, however, says he would rather go too big than too small on this, acknowledging that it may well be too big. As he says that, do you philosophically disagree with that?
I disagree. Well, so let me put it this way. I think the concern, and granted, neither party has any claim to fiscal responsibility, right? I mean, we've had deficit spending has been a bipartisan ailment. Best projections on what the actual mismatch, right? What did we lose due to COVID, right? What did the pandemic cause in terms of a loss? If you look at the GDP shortfall, to date, it's estimated to be around 800 billion, 900 billion. So if we say conservatively, maybe it'll go out to $1.2 trillion by the time we reach fuller vaccine distribution, we've already about tripled that. With another $2 trillion in this plan, we're getting ready to do a 5X. And now it's not just the debt that's going to take a hit, right? It's also the fear and the likely potential that we'll see rapid inflation on a level we haven't seen since the Carter administration. And now neither of us were really, I mean, I wasn't born yet. I don't think you were born yet, right? I mean, we don't have professional experience of what it's like to be living in a period of rapid inflation, but I think that's the real risk that we're running. So it's not just, legitimate, but maybe a bit arbitrary concerns about where the debt level should be and what the interest on the debt as a percentage of our, government revenue should be. But it's also that fundamental question of we are fundamentally altering the balance that will have long-term consequences and maybe even rapid short-term consequences. So I'm very open to making sure that I don't care if we pay a little bit more than we should be on vaccines. I think that's a worthwhile cost to make sure we get to the end of this pandemic. But the idea that just, well, $2 trillion, right? The 1.9 trillion number was chosen because the same reason why something's priced at $9.99 instead of $10, right? I mean, that was they backwards derived what should be spent because they didn't want to say this was trillions. They wanted to say trillion and change, right? Just right up to that line. So I mean, it's an arbitrary number to begin with, but even when we try to legitimize what that number should be, we're already way, way, way out of bounds with anything bordering rationality.
Okay, we'll move on here. And first of all, very kind of you, but I was alive for the last 2 years of the Carter administration. Very polite of you,
But
however.
not professionally engaged.
I got you. Got direct dollars over government access. You claim, and again, this is Senator Collins' bill, I think you said.
Yeah, that was the baseline. I used Senator Collins' bill, included in some additional items that had come up that Democratic colleagues said were necessary in order for it to, gain some Democratic support. So it's not just a messaging proposal. This is serious both in structure and in political saliency.
Okay. You think you can cut $1 trillion off of this bill, but still get $2,400 to each American who needs it? What are you cutting to get there? What goes away?
One of the biggest ones, state and local funding. Right now, it's not being allocated on a per capita basis, but there's roughly $1,200 for every American that's being given to their state governments, their city governments. That's going to be highly concentrated in large blue states and the largest cities in those blue states. California has actually turned a budget surplus, or is projected to turn a budget surplus when their fiscal year ends. The shortfall in many places hasn't been as severe as they expected it to be. I maintain some state and local funding, again, based off of what the income tax shortfall was for the city of Grand Rapids, and using that as a bit of a baseline for what a well-managed municipality, what impact that took off of COVID. So, but I reduced that number from roughly $1,200 per American to $200 per American. What we also did is front-loaded what otherwise would be spent on the uninsurance. And now, remember, this is the federal additional uninsurance on top of what uninsurance benefit, on top of what the states are already providing. So I start to tier that down in reflection of where vaccine estimates, at what point we expect to have an overwhelming majority of the population vaccinated, and begin to tier that down. So this is saying, rather than creating a position where schools are reopened, the businesses are reopened, and somebody who is unemployed is taking home as much as they were taking when they were employed, it's front loading that benefit. So there's no disincentive in terms of returning to work.
Okay.
So the money that's going is relatively similar, but it's being given at the beginning so that folks have more of an ability to determine, well, do I use that in addition, do you use that as de facto unemployment insurance, or will I go back to work when those opportunities are available, and now I can allocate how that spending is. But I also created a little, we front loaded that towards folks who were, single filers making under 50,000 as of the last tax year, and for joint filers under 100,000, per couple.
Okay.
So that way, it's targeted at the folks who are closest to the poverty line, who likely have the least amount in savings, and who are more likely to be essential workers, or others who are or in the service industry, in the hospitality industry, who are in the hardest position.
Okay. I know we're running late. Do I have time to ask you about the Equality Act, or do you need to go?
You can ask.
Okay. You voted no, and in your statement you said the lack of a religious exemption forced Americans' faith in compromising deeply held convictions. What exemptions are you talking about, and what convictions would they be compromising?
Yeah, specifically the Religious Freedom Restoration Act of 1993. That's on the books, but the Equality Act specifically said that it superseded that act. So not only were there no provisions, but it specifically eliminated any existing protections of reasonable accommodation for faith-based organizations and entities.
Example?
Well, look back 10 years at the Catholic Archdiocese of Washington, D.C., that was involved in a lawsuit over concerns on behalf of some of their staff around same-sex adoptions. And ironically, that was a case that my former Democratic opponent, Hillary Scholten, defended the Catholic Church over, or that archdiocese. So, I mean, these are examples of where and I don't want to get into all the absurd hypotheticals that have been thrown out, but where, especially when we're talking on issues of gender identity, these are evolving understandings that we have in our society. We are not reached a point where I think we fully understand or have hard definitions of what we're looking at. And now we want to federalize and have that be an issue that's going to cause ripple effects up and down the chain. And again, I don't want to get into some of the more absurd hypotheticals, but when you have, governments that file continuing lawsuits against organizations like the Little Sisters of the Poor, I'm not confident that we will have the First Amendment protections, the freedom of religion protections that we really need in this country.
One follow-up, and I'll let you go. What then do you say to LGBTQ constituents in the Michigan 3rd who just had their representative vote no against equal protections for them?
I don't think this is just about equal protections. Right? I mean, there's very few people, and I certainly don't support any means of arbitrary discrimination. But as with any issue in this country, and the First Amendment, Supreme Court caseload is full of issues where we have to strike a fine balance. There's actually competing legislation because it's unclear whether or not this will even pass in the Senate. And oftentimes a little inside baseball is that oftentimes moderate Democrats will be told, well, you can vote for this, don't worry, it won't actually take effect, so you won't have to deal with the negative consequences. There's a competing version that ironically is sponsored by a Utah Republican that really seeks to strike that appropriate balance, that gives leeway, especially to smaller faith-based organizations, while at the same time making clear that arbitrary discrimination based on sexual orientation or gender identity, should not be the case in this country.
Is that Burgess, I think his name is?
No, this is Curtis. Shoot,
I'm obviously thinking about the wrong guy either way.
No, I'm working with two different Utah Republicans, John Curtis on a lot of climate issues, and one second.
Now you want to know?
No, we're still there's a number of co-sponsors on this. sorry, Chris Stewart.
Okay.
Out of Utah. But again, we're seeking to say, okay, we're in broad alignment on the ultimate objective here. Now, how do we make sure that the unintended consequences or the unanticipated scenarios, how do we make sure that we're trying to anticipate those and carve a piece of legislation that will achieve, a positive outcome that doesn't result in kind of arbitrary discrimination, but also, strikes that right balance with existing, deeply held and sincere religious beliefs.